Hello friends, today we will discuss about lung volumes. Actually, lung volume indicates that there are the different things. This is lung volume and capacities. Capacities are combinations of the volumes. We will discuss one by one. There is a term called tidal volume. Tidal volume. Tidal volume. What is tidal volume? Tidal volume is the amount of air that is inspired or expired in a quite normal respiration, normal breath. Means if you are taking a respiration unknowingly, then you are inspiring or expiring the amount of air that is tidal volume. It is usually 500. It is 500 ml. So tidal volume means the amount of air that is inspired or expired with normal quiet respiration. That is tidal volume. Then there is a term called inspiratory reserve volume, IRV. That is called inspiratory reserve volume. What does that mean? That means that when we take an inspiration, suppose we are taking tidal inspiration, then unknowingly, this is tidal inspiration, tidal expiration. But when after tidal inspiration, you take the amount of air that can be taken forcefully, more amount of air that can be inspired forcefully is called inspiratory reserve volume. The amount of volume, the amount of reserve that can be taken after forcefully after normal tidal inspiration. Suppose I have taken normal inspiration. This is inspiratory reserve volume, the amount of inspiration extra than the normal tidal inspiration. That will be the inspiratory reserve volume, the amount of air that can be inspired forcefully after normal tidal inspiration, the amount of air. This is normal inspiration, inspiratory reserve volume. Okay, then there is the term called expiratory reserve volume. Expiratory reserve volume. This is the amount of air that can be expired forcefully after normal tidal expiration. Suppose you have taken expiration, the more air that can be expired forcefully after normal expiration, normal tidal expiration, that is expiratory reserve volume. And the amount of air that remain in the lung after forceful expiration, that is you have done normal tidal expiration, then you have again forcefully expired the all expiratory reserve volume. Now not more air can be expired out. The amount of air that remain in the lung is residual volume. Residual volume. So this residual volume you cannot take out from the lung. It remains inside the lung, and it is necessary because if every air is come out from the lung, then lung will collapse. If there will be every air comes out from the lungs, then the level of oxygen and carbon dioxide that is maintained from the blood to the in between the lungs equilibrium will be totally drastic change. So to prevent the drastic change of the oxygen and carbon dioxide level from between the blood and lungs, that is the function of residual volume, and the main function is to prevent the lung collapse. So there is another term called functional residual volume. This is functional residual volume, means this is residual volume plus something extra. That is what we have discussed about residual volume, that amount of air that remain in the lung even after forceful expiration. Functional residual volume is just the amount of air that remain in the lung after the normal tidal expiration. Suppose you have expired the amount of air that remains inside the lung. What are that remain? One is the expiratory reserve volume. You have expiratory reserve volume because you have not forcefully expired, and the amount of air that can never be expired from the lung is residual volume. So expiratory reserve volume plus expiratory reserve volume plus residual volume equal to functional residual volume. That's all. Now comes to about the another term that is known as the inspiratory capacity. Inspiratory capacity is nothing, that is the total capacity of our lung that can be inspired. So what are the inspiration? There are two types we are taking. One is normal tidal inspiration and one is inspiratory reserve volume. So normal tidal inspiration and inspiratory reserve volume, this both combination, that is the total amount of our capacity to inspire, so that is equals to inspiratory capacity, that is tidal inspiration, tidal volume plus inspiratory reserve capacity. Inspiratory reserve volume is equal to inspiratory capacity. So you are clear about inspiratory capacity as well. Now come to the vital capacity. What is vital capacity? Vital capacity is the amount of air that is expired forcefully after maximum inspiration. Means it is total capacity. So it is your capacity of the lung. It is the power of the lung, you can say. So that you have inspired forcefully. Now, so forcefully, the maximum inspiration, the amount of air that can be expired forcefully after maximum inspiration, that is total vital capacity. Total vital capacity. When we inflame the balloon, that is total. That is one of the use of your total vital capacity. So what does it includes? It includes, again, you have both tidal inspiration field, tidal volume plus inspiratory reserve volume, and plus forcefully expiratory reserve volume. That's equals to the vital capacity. So vital capacity is expiratory reserve volume, tidal volume, and inspiratory reserve volume. Then remain the total lung capacity. Total lung capacity is nothing but total capacity of the lung that is remaining. Total lung capacity, total a amount of air that remain in the lungs at maximum inspiration. So this is total lung capacity. That includes everything. So residual volume is from beginning, so that is there. Then residual volume plus tidal volume plus inspiratory reserve volume plus expiratory reserve volume. This all includes the total lung capacity. Now, what are the amount of that? That is tidal volume is usually 500 ml. 500 ml. Okay. Residual volume is 1200 ml. Expiratory reserve volume is 1000 ml. And this is 3.3. That is 3300. So this is all about the lung volume. Hope you have understood.